Hey everyone, it's Dr. Rick, and I'm going to be doing an unboxing. This is from Pendulum Products. It's a probiotic called AKKERMANSIA. The idea is to increase the amount of bacteria that are in your gut. Everybody knows about probiotics. I did a video on Saccharomyces during COVID, which is an excellent probiotic. It's more of a yeast product, but it helps with decreasing IL-6, a pro-inflammatory, and during COVID everybody was inflamed. The data on AKKERMANSIA calls it a keystone player as far as all the bacteria in your gut, in addition to the mucin layer or the barriers in your gut. So I have done videos in the past on how leaky gut occurs. Probiotics are helpful if they're balanced properly. That means no dysbiosis, and also if there's a layer between the epithelial cells of the gut lining, a layer of mucin or biofilm. And it is important to have biofilm. That's what slippery elm is used for, and marshmallow root. Both of these are options for people with the task of rebuilding their gut after several months of antibiotics. And I just talked to a patient today. She was hit with COVID and a few other things in the beginning of the year, and since that time has been having the resurgence of PCOS-like symptoms: acne, facial hair, loss of scalp hair, irregular periods. The average doctor would say, well, she's probably just going through PCOS. But if you look at the timeline of the implementation of several antibiotics and then the timeline of the beginning of the return of PCOS, everything has been fine since she delivered 2 years ago. Why do you have PCOS-like symptoms now? The theory is that the estrogen is having an increase in the blood levels. And the only way that can happen is either you're taking exogenous estrogen in the form of birth control pills, or you're making too much estrogen, which could be the case in excessive amounts of visceral fat. If you increase your weight and you have more fat than usual in that omentum or the belly, then that can act as a source of estrogen secretion. Has the digestive system is so well balanced in making you poop out bad stuff. The liver balances the levels of testosterone and estrogen in your bloodstream by saying, hey, there's too much, let's break this down and put it in the stool. The problem is if the components in the stool get broken down and reabsorbed because of the bacteria in your colon specifically, you reabsorb more estrogen and you're making too much estrogen already, so it logarithmically increases, giving you the symptoms of PCOS. Kind of like guys taking testosterone or having estrogen levels that are climbing. I usually have to look into the gut or decrease the testosterone dose. So you can see how the gut plays a very important role, and you won't see your average gynecologist or family practitioner that gives the prescription dive into the gut microbiome or dysbiosis because it's not really taught in medical school. There's a new article in Cell magazine. Cell magazine is one of the apex journals of reliability for determining what is valid in the scientific community. In Cell magazine, dysbiosis is one of the important things to consider, now listed as one of the components or the pillars of healthy lifestyle and longevity. Being embraced by the scientific community, it's not being embraced by the medical community. Again, it wasn't something that we were taught. Even the GI specialists, a lot of them that I know of don't even talk about small intestinal bacterial overgrowth, SIBO. There used to be one in Arlington Heights that would do fecal transplants. I can't find anybody to do fecal transplants. And fecal transplants sound gross, but they are the treatment of choice for anybody with C. difficile infections. That's an infection of the colon with this bacteria called C. diff. It's debilitating. It causes diarrhea, it causes malabsorption. It's usually because of antibiotic overuse. The treatment of choice is not available in the area. I don't know why. Maybe it doesn't get reimbursed, or maybe we're not educated as doctors to do that. But you can re-inhabit or re-inoculate your gut with that. You can do probiotics, and I think this is one of the best probiotics I've seen by Pendulum Products. Not only do you have a probiotic, which is AKKERMANSIA, but you also have the stimulation of GLP-1. For those of you who are on a weight loss journey, GLP-1 is what you find as far as the semaglutide, which is Ozempic, or tirzepatide, which is Mounjaro. Both of those are injectables that have revolutionized weight loss. The unfortunate problem is that weight loss, which is rapid with those two shots, and I've done videos on both of them, weight loss is massive, more than 10% of your body weight. So that could be 30 pounds for a 300-pound patient. But the problem is that the data now, which wasn't released initially, is showing that people on those shots will have 60% loss of fat, but 40% loss of muscle. If you lose lean muscle mass in addition to fat, when you drop down to skinny levels, you'll also be gaunt. You'll have no muscle mass like before, and you'll be stuck. Because as soon as you get off the shot, you'll be weak, and you won't be able to use your muscle as a depository for cholesterol or glucose, and you'll have your metabolic syndrome come back. If you don't have any muscle, your metabolic rate goes terribly lower than before, and you have no way to burn it off. You'll be stuck on those medicines forever. Increasing your own body's GLP-1 production, the mechanistic data that shows this is great for helping with balancing metabolism, getting rid of metabolic syndrome. The mechanism, it's more basic. Mechanistic data or animal studies are fair to interpret and understand, or at least read. You always want to have human data with the implementation of AKKERMANSIA or other things to prove whether it's worth it. That's more at a population level, but when I'm taking care of patients one-on-one, I will see what's going on with them. I'll try to implement change. So in the patient I mentioned earlier who is having a difficult time with losing weight, balancing mood, and then having the periods maintain themselves, I think that it would be fair to implement a reinoculation of her gut with something that's helpful. We're going to also take care of including the fibers that are important for building the biofilm, gut slime that houses the bacteria or your probiotics. Again, I mentioned that slippery elm and marshmallow root are great. This is something called iberogast. This is more of a homeopathic that I use for people with SIBO, small intestinal bacterial overgrowth. When you have too many of the bad bacteria in the small intestine when they're all supposed to be in the colon only. It's important to have a slime layer. It's important to have bacteria, the right combination. Otherwise, if you have too many bad guys and not enough good guys like AKKERMANSIA, Bifidobacter, Lactobacilli, then you'll have dysbiosis. And again, the data that I showed you with regards to longevity. So one way to trigger dysbiosis, getting under control, is to have a girth of good bacteria. And we'll talk about this now. I think there is great information on what that bacteria does, AKKERMANSIA. It does show in animal data that it reverses dysbiosis to feed the other bacteria in your gut with building blocks that they need for food. The probiotics you take have to have a level of their own nutrition. The slime layer is the way that they feed. If you don't have a slime layer and you're, say, totally carnivore and you don't have any fiber that comes in, then those probiotics that you have, and we all have them, will actually feed on your lining. If there's not enough slime, then the next layer underneath the slime is your cells. And when those probiotics are in you and they have no food, they'll eat your cells and they'll cause leaky gut. AKKERMANSIA has a bacteria, will also help with zonulin, and it'll put together proteins that are responsible for keeping the tight junctions tight. When you have a tight junction, which is a cell-to-cell connection in your gut that opens, then you have the option of having all that stuff in the colon get into the bloodstream. And some things are good: proteins, fats, carbohydrates, building blocks, minerals. Some things are bad: toxins, fungi, parasites, metals. So when you have the tight junctions open, everything goes in, and that's where you have leaky gut. So when you have a bacteria that will actually make the tight junction stronger, then why not? Especially if you have leaky gut. AKKERMANSIA works to increase mucin. It eats mucin, which is one of the parts of the biofilm, the slime. It eats it, and when your enterocytes, the live line, those cells that you have, feel that the mucin layer is being decreased by AKKERMANSIA eating it, those cells, enterocytes and panth cells, actually make more mucin. A study done where they gave patients a placebo, they gave patients AKKERMANSIA, and they gave patients AKKERMANSIA that was dead. And even the dead AKKERMANSIA stimulates those little cells to tighten up the junctions. Definitely a synergistic effect that this bacteria produces mucin to house and make thicker biofilms, so other bacteria will be able to stay in their house, their slime house, in addition to feed on the mucin layers. The final thing I wanted to point out is that this study pointed it out, that AKKERMANSIA increases GLP-1. That's glucagon-like peptide, number one. It's an agonist. We make it on our own. The problem is if your gut's not working properly, then you don't make it until you get the injection. And if you don't exercise with the injection, then you're stuck on that injection for life. There was a warning before Mounjaro was released that people who start Mounjaro will probably be on it for life. That's brilliant by the pharmaceutical companies. It's important for you to do your own thing. That if you're going to do a fasting diet, because during fasting or decreasing your caloric intake, probiotic or your gut microbiota, they contract and only stem cells become the living cells until you refeed, and then those stem cells, which are healthy, they start to blossom or bloom a new microbiota. Why not just do this as your probiotic? If you are totally inflamed or you're suffering from ulcerative colitis or Crohn's disease, so if you have inflammation from metal toxicity, Lyme disease, fibromyalgia, arthritis of any sort, it's important to decrease inflammation. I believe you can order this online. I ordered my own bottle, which is pretty pricey, but all probiotics are pretty pricey. And in theory, at least as far as Pendulum products, they say it takes 3 months to inoculate your own gut. Trying this and changing the way you do things and you work your digestive system for 3 months would be worth the trial, especially if you're like my patient who is trying to rebuild her gut after being slammed with antibiotics, or if you say have sudden food allergies that are popping up out of nowhere, or a lot of insulin resistant, polycystic ovarian syndrome, or you're autoimmune and it's flaring up out of nowhere. I think it would be worth it to attack the gut, or at least change around and manipulate your own gut. In addition to considering the medications that your doctor is using or the supplement adjustments that your integrative medicine doctor is helping you with, it's a great frontier to trigger and use as a priority, especially if you've done everything and you're on a whole bunch of medicines, you just can't get any further. It would be worth trying or investigating fixing your gut. So hopefully this gives you a couple of ideas. If you have a probiotic that you use that you find helpful, please put it in the comment section down below. And if this helped you, or you know anybody else with gut issues that might benefit, share this with them and consider subscribing to the channel. Thanks for watching.